everyone, it's Diabetic Danica and welcome back to my channel. Today we are going to be doing a Snapchat Q&A. If you don't know, I do have Snapchat. It is do I have to say at anymore? My username is dmarieisme. So yeah, go follow me on Snapchat if you want to be a part of future Q&As. But for now, let's get into your questions. Alright, so the first one is from Callum Dennis. Make sure my volume is all the way up.
So how do you deal with your insulin on your runs? Being a really keen cyclist, takes me a lot of prep being at a 1MDI.
He said, how do you do your insulin on your runs? Because when I was asking for questions, I was like, hey guys, I'm going on a run, but leave me your questions for the video. So I do less insulin on runs instead of more carbs most of the time. I have an insulin pump, so I do negative basal rates. So for temporary basal, I just choose a percentage, and it's kind of just over time I have tested and guessed and seen what works best for me based on the exercise and my blood sugar and everything. So I can be anywhere from negative 60 or 70% basal to negative 100% basal. Well, not usually 100, maybe like 90%. Before this run, I was dropping pretty fast, and so I ate a snack and I did the negative basal. I think I did negative 90. To try to prevent the low, and I still went low during that run. So yeah, it just takes a lot of practice and trying different things to see what works best for you and talking to your doctor and everything. But for me, I do a negative basal, a pretty high amount, usually about negative 80% for the run and also for a little bit after. Because my blood sugar can go low. When I played basketball in high school, it could go low like 7 hours later. It was crazy. So back then, I would also do a temp basal overnight. I did negative 20% for 2 hours. Alright, next is from Hannah Gwilt.
Hello, I was wondering what your thoughts are on mini-dosing with glucagon for regular diabetes treatment.
Oh, okay, that's an interesting question. She was asking about just basically mini-dosing is like you have the glucagon kit, but you're not going to use the whole thing. You just drop a little bit because you're low and say you don't want to eat or something like that. I personally have never done this. But I have heard that you can do it, just in general, like, out on the town, I've heard that, like, not from my doctor or anything. But I feel like if you are able to eat, you should eat, and if you're able to drink something, you should drink something, because, I don't know, just in my own mind, I'm like, why would I want to make my body, dump the glycogen in my liver if I don't have to? And I kind of want to save that in case I really do drop. So let's say you're kind of low and you just don't feel like eating. So you give glucagon and then you go super low and you really need it. I would think it wouldn't be as effective because your liver is more empty of glycogen, right? But anyway, all that to say, I have never done mini dosing off of a glucagon kit. I've never used glucagon, but in my mind it is for emergencies. But I do know how glucagon works, so if you want to check out my video where I give a tutorial on how to use the glucagon shot, I will link it down below. Also, glucagon is really hard to say fast. I'm like, glucagon. Alright, next is from Casey Jordana.
What is it like being type 1 diabetic and being a nurse? I'm going to medical assistant school, so I was just curious about it. Also, do patients ask you a lot of questions since you're type 1 diabetic and a nurse?
Alright, so what is it like to be diabetic and a nurse? It's great when you have diabetic patients because you know what they're talking about, you know what they're going through. I haven't had too many diabetic patients, but I have had a few, and I know it's been helpful to be able to talk about my own experiences, to introduce them to the CGM and insulin pumps and all that stuff. And I had one patient who was my exact same age that I was when I was diagnosed. She was 11, and she was learning to prick her finger for the first time, and I was just kind of letting her know that I was there too once, and I know how it is, and kids aren't always great about expressing that helps, but I know that it does, and her mom was able to express how much that helped and how good that was to hear that I had gone through that and could help them along the way. So it's really great for that. For management of diabetes, it's not great because being a nurse is very unpredictable. Some shifts I sit down most of my 12-hour shift. Some shifts I don't get a break until 3:30, which is 8 hours into my shift, and I am on my feet all day. So it really varies, it really depends, and it can be hard to get your blood sugars stable, especially because I work rotating, so I work days and I work nights, and they are 12-hour shifts, so they're super long. So I have found that it's been difficult. My A1C definitely went up this year. Not to anything crazy, but not where I want it. Especially as a new nurse where I'm trying to just learn how to function as a nurse, it's hard to also focus on my numbers at work. Not saying that I wouldn't treat a low or a high at work, but I'm just saying I wouldn't notice as much the trends and the overall picture. But this year I have been focusing on that more. Now that I've been a nurse for a year, I feel like I have the capacity where I can really focus on my trends and my numbers, and I am actively working at analyzing my blood sugars again so that I can get my A1C back down where I like it. But I'm definitely looking forward to the day where I don't work nights, and hopefully someday where I don't work 12-hour shifts. Next question is from Lindsay Ann 94.
Hey Danica, my question for you is, what advice would you give to type 1 diabetics looking to start a YouTube channel about being a type 1?
Ooh.
Also, I wanted to say that I'm a huge fan, and I've been watching your videos since I was diagnosed almost 3 years ago. Your videos have really helped me gain a lot of confidence in my own diabetes care and in being a diabetic, and you're just the coolest person ever, so thanks.
That's so nice. So first of all, I totally recognize you from the last Snapchat Q&A. That's awesome. So advice for starting a diabetes YouTube channel. I get asked this pretty frequently, semi-frequently, but a lot of people ask it in the way of like, should I start a YouTube channel? And I'm like, yes, do it, please. You don't have to ask me, just go for it. And I know that I would love to see more diabetes YouTube channels out there. There really aren't a lot. There's a handful that post regularly, but it'd be awesome if there was more. We always need more perspectives and more points of view, which is the same thing. I guess my biggest tips are learn how to edit a video, which really isn't hard. A lot of computers come with basic editing software, and all you really have to know at first is how to split clips so that there's not a lot of dead space in your video where you're not doing anything or like adjusting your hair or coughing or something. Like, I've coughed a lot in this video, but guess what? I edited them all. That came top. Like in this video, I have coughed a lot of times, but guess what? I edited them all out. So editing helps. Make sure you're in a well-lit room. If you don't have lights yet, I didn't have lights forever, I would just use a window because sunlight is actually really great lighting for videos. And then camera quality does help. I'm not saying I have the best camera quality, but it is higher definition, and I think that always helps. But again, I started on a webcam, and that's totally fine when you're starting out. I think the biggest thing is just making good content consistently. If people can rely on you to make videos consistently and that they're going to be high quality, then that's what they're going to watch. I've seen a lot of people start a diabetes YouTube channel, be really into it, make 5-10 videos, and then it just dies. And they don't put up a video for months, and then they come back and they say, sorry, I was gone, I was busy. And then they make a bunch of videos, and then they're dead. They don't talk forever. So I don't think that's the best way to grow your channel because it's not reliable or consistent, and you don't have like a back and forth with your audience. So I know I don't have a schedule. I don't have a posting schedule. I don't post the same day every week. I don't even post every week. But I do try to not let a whole month go by where I don't post, and I want to be consistent. So yeah, those are the main tips that come to mind. Not by any means am I an expert, but I think we definitely need more diabetic voices on YouTube. All right, the next one is from Maya Al-Haddad.
Hi, Danica. I was wondering, what do you eat when your sugar's high, but you really want something sweet?
What do I eat when I'm high, but I want something sweet? I don't know if I have something sweet that I eat when I'm high, but something low carb I like. Let's see. Sometimes, honestly, just drinking something low carb helps. Like, I love Diet Coke, and it's horrible, but I mean, soda does kind of fill you up a little bit. Not saying this is healthy by any means, but it is something low carb and a new taste in my mouth where I kind of feel like I'm eating. I also like meats and cheeses. Peanuts I like. Salad is always a good option if my blood sugar is high and it's mealtime. Salad bar is the way to go because I feel like you can put a lot of stuff on there, a lot of variety, but it's still low carb, like lettuce, meats, cheeses, all of that. A lot of veggies are low carb. Also, when my pump died recently and I was really trying to avoid spikes, I found out that Jimmy John's has unwitches where instead of bread they have lettuce. So I did that when I was high, and I still was ready for a meal, but not a high carb one. All right, this is the last video question we're gonna do. This one is from Danielle.
What do you carry all your supplies in throughout the day? I know you have the phones like I do, and the CGM, but as far as bag for everything else?
All right, what do I carry my supplies in? I just use a purse. When I was first diagnosed, they gave me like a diabetes kit specific for diabetes supplies because I was 11, I didn't have a purse. But then once I got older, I was like, I can just carry any bag. Like, as long as it has enough room for everything, I should be fine. So I just make sure my purse is big enough for my wallet, for my pump supplies, for my keys, for my phone, snacks, all that good stuff. I actually have 2 different videos on what's in my diabetes bag. I have one from a while ago, and I have one with my newer Diabetic bag, which is technically a diabetes specific purse, but you can really use any purse. They're just super cute and they sent it to me. So yeah, I guess I'll link those videos down below as well so that you can see those if you want to. But the short answer is a purse. Ooh, we got another video question while I was talking. So this one is from Lena1103.
Hi Diabetic Danica, my name is Lena and I have a YouTube channel called Type 1 with Lena. I was wondering if having diabetes influenced your job choice.
Definitely, yes, it did. I want to be a diabetes educator, and I never would have wanted to be that if I didn't have diabetes. Like, there's no way. I don't even know what I would be. Maybe like a teacher? I don't know. I couldn't see myself in a school forever, though. I love kids, basically, and so I want to be a pediatric diabetes educator. But yeah, definitely my diagnosis has shaped a lot of what I do. It's my whole focus of my YouTube channel, and it's the reason I'm a nurse, and it's the reason I want to be a diabetes educator. So I think it's cool, though, how it's changed into something that at first was really, really hard and devastating and changed my life completely, and now it's become a positive, and it's become a career path and a passion of mine. So yeah, I'm just thankful that God has turned a negative into a positive for me. So thank you so much for your questions. I really appreciate it. I love answering them. I love being able to see your faces and hear your voices when you're asking them. So if you like this video, give it a thumbs up. Don't forget to subscribe if you haven't already. I make new videos about diabetes all the time. And leave a comment down below so I can talk to you guys more. Alright, so I'll see you guys later. Bye. Cut.